Principle and level disease in prevention and control. Let's introduce my group names. First is Azrini Shah, second is Rafahana, and third is Siti Najah. We are from UiTM Puncak Alam. So at the end of this topic, we'll get to discuss between agent, host, and environment and human in disease transmission. Discuss the principle of disease prevention, describe methods of control and prevention used for communicable disease, and definition disease prevention, control, elimination, eradication, extinction, isolation, and also quarantine. So what is host, agent, and environment? Host is intrusive factors that influence individual exposure, for example, age and socio-economic status. Environment is intrusive factors that affect agent opportunity to exposure, such as crowding and sanitation. Agents, infectious organism, bacterium, virus, and parasite. Infectious agents. Infectivity refers to the proportion of exposed person who become infected. Virulence refers to the proportion of person with clinical disease and who become severely ill or die. Pathogenicity refers to the proportion of person who develop clinical disease. So natural history disease, a disease in an individual over time without intervention. Begin with exposure to accumulation factors that are capable of causing disease. And without medical intervention, the process ends with recovery, disability, or death. Natural history of disease. What is the major stages in disease process? First is stage of susceptibility, stage of subclinical disease, stage of clinical disease, and stage of recovery, disability, or death. For stage of subclinical disease, we'll divide it by two, incubation period and latency period. So this is a natural history of disease. So let's go one by one through this topic. Please enjoy this video. So this is the stages of release during infection and transfer of infectious agent through contacts. Stage of susceptibility. Appropriate exposure to or accumulation of factors sufficient for disease process to begin in a susceptible host. For example, the exposure is a microorganism. In cancer, the exposure may be a factor that initiates the process, such as tobacco smoke for lung cancer and estrogen for endometrial. The stage of subclinical disease. Pathological changes then occur without the individual being aware of them. This stage extends from the time of exposure to onset of disease symptoms, called the incubation period for infectious disease and the latency period for chronic disease. Disease is said to be asymptomatic, no symptoms, or inapparent. Hypersensitivity and toxic reactions to as long as decades for certain chronic disease. For example, the typical incubation period for hepatitis A is as long as 7 weeks. Incubation or latent period. The time interval between infections to development of clinical disease. For example, Ebola virus infected patients do not pass the virus on to others during the incubation period. The stage of recovery, disability, or death is the outcome of the disease, accident, or injury become apparent, resulting in recovery, disability, or death. Transmission of infectious disease. So this is the change of infection started with infectious agents and end of susceptible hosts. The change of transmission of infectious disease started with viral bacteria, protozoa, fungi, to reservoir where the agent normally reside, portal of exit, how the agents leave the host, mode of transmission, direct or indirect contact, portal of entry, how the agent enters the susceptible host, and impact by overall health genetic factors. Hi, so let's start with the second chapter of the principle and level disease prevention and control. Like in our previous video, I would like to represent again my group members. First is Azrini Shah. Second is my Nurfahana, and third is Siti Najah. And what is disease prevention? It covers measures not only to prevent the occurrence of disease such as risk factor reduction, but also to arrest its progress and reduce its consequence once established. Disease prevention efforts can be classified according to the stage of disease they are applied. First, primary prevention, second is secondary prevention, and third is tertiary prevention. So, these is the stages in the natural history of disease and level of prevention. We will go through slowly one by one in this video. Primary prevention is the stage of susceptibility before the pathogen establishes itself in the body. The goal is to prevent disease from occurring, reducing its incidence and prevalence in the community. For example, needle exchange programs to prevent the spread of HIV. Tertiary prevention is directed toward the clinical stage. The goal is to prevent or minimize the progression of the disease or its sequel. Screening people with diabetes for diabetic retinopathy in order to promptly treat the progression of blindness is the example. We have a few contents in a disease control. Control, quarantine, isolation, elimination of disease, elimination of infection, eradication, extinction, and others is endemic, epidemic, outbreak, and pandemic. In disease control is the reduction of disease incidence, prevalence, morbidity, or mortality to a locally acceptable level as a result of deliberate efforts. These continuous intervention measures are required to maintain the reduction. Isolation is the procedure used in communicable disease control. It consists of a separation of cases in person or animals, minimize the risk of direct or indirect transmission of the infectious agents to those who may be susceptible. In quarantine is the restriction of the activities of healthy persons or animals who have been exposed to a communicable disease. It prevents transmission of the disease from potentially infected person to healthy person during the incubation period. Elimination of disease is the reduction to zero of the incidence of specified disease in defined geographical area as a result of deliberate effort. So, elimination of infections. Reduction to zero of the incidence of infection caused by a specific agent in a defined geographical area as a result of deliberate effort. And last but not least, eradication is a permanent reduction to zero of the worldwide incidence of infection caused by a specific agent as a result of deliberate efforts. Intervention measures are no longer needed. So these the other important terms. Endemic means a disease occurs continuously and with predictable regularity in a specific area or population. Epidemic is a widespread outbreak of an infectious disease where many people are infected at the same time. Pandemic and epidemic occurring worldwide or over a very wide area crossing international boundaries and usually affecting a large number of people. An outbreak and epidemic limited to localized increase in the incidence of disease. Prevention. The goals of medicines are to promote health, to minimize suffering and distress, to restore health when it is impaired, to preserve health. Decrease of your risk of infection disease by understanding how they spread and how you can protect yourself. First, do hand washing, get vaccinated, use antibiotics sensibly, pay special attention to cleaning the hot zone in your homes, be smart about food preparations. Stay at home if you have signs and symptoms of an infection, don't share personal items, travel wisely, and keep your pets healthy. The components of healthcare-associated infection is controlling the reservoir, early diagnosis, notification, isolation, and also quarantine. Second is interruption of transmission, that is breaking the chain of transmissions. Third is susceptible hosts, active immunization, passive immunization, and combined active and passive immunization. Fourth is a proper education and consultations. Last but not least is a legislative measure to formulate an effective implementation of measures. This is the breaking the chain of infections that involve all health professionals' care, including you. So this is our reference that helped us a lot to complete this assignment. Thank you for your attention.
Created using Powtoon.